Rob, thanks so much for coming today.
I appreciate you having me.
So listen, I updated my website, and I want to have some stuff that I put on to help explain a little bit more what I do. And I thought I really like to have somebody that can bring out the best in me, and you're the first person I called. And thank God you said yes. Because I didn't really have a second person.
There was no second choice.
Frank was number 2, right, behind the camera, and he would have done a great job. But of course, we've been working together for 2 years, so precisely what it is that I do and what I'm trying to accomplish. And I thought that it would be a great way to kick off a great conversation.
Oh, that's such an honor, because it's 2 years, sure, but I think it's, for me, it's seeing what you've gone through and seeing how you've iterated, and like I don't know, it's a weird word to say, but I'm proud of you. Like, it's very clear what you've done and where you've gotten. So to be asked to be here, to ask you questions, to help you clarify, speak to the world in a nice setup with video and audio of what you do and who you serve, it's a worthwhile thing for me. So maybe let's talk about why medical clinics, because that's where you are now. That's who you're serving. I know the magic of what you do. You could technically help almost anyone in any organization, but why medical clinics?
That's how it started out, right? When we met, I had a very general approach, and actually what motivated me was wanting to get to know other industries, other people. And I still have clients that I started out with that are not in the medical industry, but what I found through your gentle prodding was the idea. I've heard different expressions in the past. The riches are in the niches, and that idea of really trying to identify with one group. And so there's so much that I get out of when working in healthcare, because I have a background there. And then when I tie that back to the education part, which is such a huge part, right? I was a teacher for 10 years, and it was such a big part of my life. And I thought that was going to be my whole life. I never thought that I would ever do anything like this. But when I really think about where I want to focus my time, where is the need? And when I think about healthcare in our province and in our country, there's so much support that these people could use right now, and I think that I could really be helping them. So that was the easy path. And then it has been more difficult in trying to then find out where is it exactly where I can bring the value and I could be a part of it. Because really what I'm trying to do is be a catalyst, jump in and help things to be moving quickly, because I'm not a nurse, I'm not a receptionist, I'm not a doctor, right? Like, I don't do those jobs, but where's my place?
I love about that is, yes, so you've got a background working with people in the medical field. There's a teaching component. You were a teacher for a decade, but it's very clear that you care, and you realize that the people who are in this profession, the people that are in medical clinics, that it's tough, and they are the ones who are taking care of others, but who's taking care of them? Who's supporting them? Who's giving them the leg up, the support to be able to do better by the patients, really, is the way
Totally.
The way I hear you almost talking about, like, the deeper meaning of it all.
Mm-hmm. It's so cool, though, because someone comes into your office, you're a physician, you're a nurse, or whoever it is. You always see that sign, one problem at a time or whatever, but can you really narrow it down to only one thing? You have a whole human being in front of you who has a condition, and can you just treat just that condition, or do you treat the whole human being, right? And so those that do take that approach, think about the challenge that is associated with that. If someone all of a sudden gets into a really deep conversation with you and you only allotted 15 minutes, how do you, sorry, time's up. You'll have to continue on with your life-changing, crisis at another time, right? It's almost like the phone, remember the pay phones back in the day, you put $2 in, and then once you ran out, you have 30 seconds left, right? You can't quite do that when it's with human beings. So all of a sudden, this creates a whole bunch of issues. Lineups form. People start getting behind. People become stressed. And then what does that communication look like between a receptionist and a nurse, or a nurse and a nurse. And now we're talking teams. We're not just talking one doctor with one receptionist. There's different models of care. And when you start getting into all these different areas of having all these different people, and then what is it like if you have to give feedback to someone and they're not really comfortable with that?
Oh,
that's where I come in.
That is where you come in. What's cool about that is you start with this idea that the way that the healthcare system is set up is that it's one problem at a time, but that has a cascading effect. That has this down effect of other people.
Downstream
effect. That's what, thank you.
Yeah.
It's funny, that word was missing in my brain. I was like, there's a word there somewhere.
Because it's winter, man. The streams are frozen.
The downstream effect of how it affects the other people. The other part about that too is you're talking about treating the whole person who's shown up and not being robotic with them, not being like, sorry, your time is up, or sorry, you had one problem, you've used it, which is also the sense I get from the way you work with people, which is also treating the whole human. Happens in the patient experience you just explained, but that also happens with the employees, with the staff in the clinic.
100%. Yeah. So, and what does that look like, right?
Yes. Yeah.
Right? You have someone who's showing up to work, and when my kids were younger and I was a teacher, and your kid wakes up at 3:30 in the morning, I could take the day off, call in at 6:30, they get a supply teacher in, and I got nothing to worry about. When you're in a medical clinic, there's no supply teacher for the nurse, for the receptionist. When someone doesn't show up, someone else is filling in that job that day. You're not bringing someone from outside, or they don't see the patient at all, right? So then you start getting people to work in pushing themselves, or not showing up, and then it falls onto other people. So then what does that look like? How can people communicate in those moments to get to the priority moments? Some people are really good at it, and some people are more shy. Some people take more on themselves and would sooner be that helpful person that is not going to complain and just take it all on, people pleaser, whatever you want to call it. But then how do you open up and create a culture where people can communicate very respectfully candid, in this respectful candor, right?
Yeah. And well, it's interesting because communication is the crux of a good relationship, of a good organization, of a good anything. And there's no not having problems. Like, there's going to be challenges. There's going to be difficult situations. You've just painted a really great one. And what's interesting is you start talking about, well, some people will be good at communicating, other people will. And then you started to talk a little bit about how there's different kinds of folks. And I know this is a centerpiece of how you help organizations and how you help these clinics, is helping them understand the different kinds of people, humans that are in their team. Talk to us a bit about that.
How do you break this down? And this is where, when I had to teach grade 11 biology, and we're talking about Krebs cycle and the process of glycolysis, and how do you break that down into simple parts, right? So that was the challenge for me, and I take different approaches, but sometimes you come up with a persona, or you come up with a scenario of what that looks like, and then when I do like my team synergy workshop, as I call it, we get everyone together and say, okay, here's the situation. Now, how does it play out? Like, here's the first part of the story. Now let's create the rest. What could that look like? And that's really cool, because when I work with people, I give all the content ahead of time. And so when we get together in whatever format, retreat, workshop, whatever it is, it's all interactive. And it's everyone bringing their voice and what they think to the game. And not everyone's great at putting their hand up and sharing. So then I bring a whiteboard, or we use a Padlet, and everyone gets a chance to quietly do it on their phone, so that everyone's different persona, everyone's different personality can show through, and then they can have a different perspective of how they see things. And that's where the magic happens, right? It's just, you can't plan that. And I was a science teacher. That's very prescribed. You know what we're going to be talking about. But then I started teaching drama. It's not prescribed. You get an idea, but what people create in the moment, and then how people respond to that, is where the magic happens. How do I recreate that in a workshop where it's nervous for me? I'm anxious because you're creating something. I don't know what the end result is going to be. because everyone's going to contribute. And at the end, it's almost like putting a painting on the wall and everyone's going to go out and paint something. And at the end, you see what has been created. And I think that that's where the magic happens. And so how can we recreate that in the workplace after the workshop? And that's another area where I help to work with people. When it's a one-off, you do what you can. When it's an ongoing client, then you can start to apply the things that we're talking about in the moment.
All right. I want to ask you a bit more about this ongoing piece, because there's a clear difference between a one-off, almost transactional, like make the most of 90 minutes or 2 hours, versus the ongoing piece. But there's something really cool that you said there, which is, one, not only do you understand the fact that there's different people in each team, different people in each clinic who have different personas, different communication styles, so therefore provide different channels, different ways to interact, different ways to do it. But you talk about this co-creation versus, because I don't know, most people who are listening, I suspect, have been somewhere where you've just attended a lecture, where there was some download, someone fire hosed and dumped a shitload of information on you, and you were just like, versus it sounds like you're very intentionally co-creating on the spot. Like you said, you share everything ahead of time. So then when you come, it's this live interactive building happening together. So it's something being created there and then.
Yes. And if I come up with a concept or a framework or some type of model, we practice it in hopes that you'll be able to let it come out naturally when the next time you see that, right? And Rob, I know you're a music guy, and and Frank as well behind the camera as a drummer as well. When I used to take drum lessons, my drum teacher would always say, "Now forget about it." We'd learn something, we'd work through it for an hour. And he's like, "Don't even think about it again until you practice next time. When you go to a gig, when you play, it's going to come out. Don't force it." And believe me, there's a lot of times when I used to try and do something that was, I thought would be really cool. I'm going to put it into this song, and then I botch it. And then, I'm a drummer, so I'm sitting at the back, and all of a sudden you get one of these. The guitar player does the turnaround and look at you and just like, "Yeah, don't do that." Let it come out. Just like today when we were meeting, what are we going to talk about? Okay, we had a general idea, but that's it. Like, let's just talk, and here we are, right? So we don't have that plan of what it's going to look like. So bringing it back to what you're saying, here's a prime example of one thing that I do with medical clinics. You have a group of nurses and receptionists, administrators. And what I noticed over time is that you have a generator of work in a nurse and a receiver of work in the receptionist. So automatically there is one person giving work to the other. And so with a generator receiver model, what does that look like? Now, if you're the receiver and you're the type of person that is very assertive, then if your rule is bring me something in within 24 hours, I'll look after it. If someone comes then and says, "Can you have this done in the next hour?" Okay. Next day, "Can you have this done in 30 minutes? Okay. I don't like where this is going. The next day is like, "I need this right away." The assertive person will say, "Don't do that." Right? Like we already talked about this. I understand things happen at the last minute. I need to find that balance, because otherwise my work becomes unmanageable, right? We have the system, work within the system. What happens if the person isn't assertive? And 90% of the time, they're not. Now we're getting into persona, right? Now you're looking at someone that loves a routine, very well organized, detail oriented, but when it comes to a confrontation, they're not very comfortable. Are they going to push back on the other person like the assertive person does? So now you have that receiver that all of a sudden has this work piled up, and if they can't manage it, what happens? They go to the WhatsApp text with their friend, "I can't believe this is happening." They take a day, can't handle this anymore. They avoid talking to the person, and the other person doesn't know why they avoided them, or they quit. So could that have been managed differently if we would have done a workshop and then opened it right up and tried to create that respectful candor so that people can have this conversation? Because there is a bit of a power, help me out, Rob, power
balance? What?
Imbalance. Thank you. Where if it's someone that they see as a quote unquote equal, it might not be as difficult. But all of a sudden, what if there's 5 physicians in the office? 4 physicians are following that rule and 1 isn't. And that one person is the person who owns it. And then they start coming and then they skip line and they say, I need this now, I need this now, I need this now. What is the implication of how the other people who are following the rules are not going to be, they're going to be unhappy because the expectation of what they're hoping to be coming back within a certain period of time isn't happening. And then if they're not the type of person that's good at, anyway. But we could go on, but now we're painting the picture, right?
Painting a really full picture because these are regular occurrences that are unavoidable that happen in any day of work, especially within a clinic. And it's either you understand the different communication styles, the different personas, and therefore you can address the situations differently and avoid bad outcomes. Or if not, it's, avoidance, sick days, or quitting, which is terrible. It's obviously a very bad outcome. And the other part too, which you didn't say, but I know is true, in the case of someone who's doing more of the admin work, and you talked about maybe they're more organized and they're more routine oriented, and we want them to succeed at that role. Those are traits that are needed and wanted for that role. Yes. So if those are traits that are needed and wanted for that role, and often if those traits also come with not assertive, well then you're set up for a situation where there's going to have to be some difficult conversations or there is some imbalance. So it's a matter of we love this person, we hired this person because they are organized, because they love routine, because they take this chaos and make things happen. But you have to then understand that there's a underbelly to that, which is if there's confrontation, they may not be set up in a way to be able to deal with it in a way that's healthy. And I think that's often forgotten, to realize that there's 2 sides of every coin.
100%. Yeah, different perspectives. There's one of my workshops, Rob. Thanks. We never planned this part. So here's the other thing, right? And this is where you help me to get, and that is, who is that person that would best benefit from what I'm offering? And what I found is it's that person that's running a medical clinic, taking it on, running it like a business, and they're visionary, they're innovative, they want to push the envelope, they want to try new things, and then you have that group of people that are finishers, that are implementers, that are routine, detail-oriented. They're not great with change. So really that's where I've landed on, is a lot of the work I do is how do you create a sanguine culture, right, of people that are will receive change optimistically. And that's a huge part of my work in bridging that gap between the push for change and those that they're not resisting it because they don't want to change. They're resisting it because you are disrupting the routine of what makes them successful.
Ah, I love it. Sanguine, I love it. This optimistic approach towards change, because the change is inevitable. And so that brings us back to something you said earlier, and I said I wanted to come back to. You'll work with people if they can only do a one-off workshop. If this is all they have the mind space for, the budget for, I know you'll do these. You've got a slew of these workshops that are highly effective that you'll come in and do. But then you also mentioned the difference between that and ongoing. So talk to us a bit more about that, about what you're able to do with a clinic and what you're able to do with a team if you and when you get into the longer ongoing support.
So the first I call team synergy workshop. That's usually like a one-off. Someone will say, and I have clients now that every year we do a retreat in the summer, and would you be willing to come and do a two-day retreat? And what do you have for us this time, right? And we help to, co-build something. I have ideas, but I also want to meet them where they're at. Then on the opposite end of the spectrum are someone that sees the value and wants me to come in and work with the group consistently. And a lot of times that comes with a project that they're associated with that they want to see implemented fully. And I don't work there. Like I said, I'm not a doctor, I'm not a nurse, I'm not a receptionist, but I'm a catalyst, and I can work with each person, understand what needs to be done, and then what do I need to keep nudging that forward? Because the perfect thing about what I can bring is I get to leave. So, right? If I need to push something, the owner, manager, whomever that person is, leader, is grateful that someone like me is there to come and push, because if they were to do it, it could result in, not bad feelings, but if they're not someone that is naturally comfortable with pushing, then I could play that role, right, in a different way that they don't have to. And then in between, I have like a leadership workshop that's like a longer 3, 4, 5, 6 months, just depends on what they want to accomplish, which is very helpful for that implementation phase, but they can run it and I'm behind the scenes supporting them.
And it's clear this idea that there's a benefit of you being an outsider, that you don't work there, because obviously initially there's this outsider perspective. You can look at things more objectively. You haven't got a horse in the race. And then also if there's something that needs to be pushed, something more difficult conversation, like you can bring things and it's okay because you're not going to be there the next day. You talk a bit about,
and I just want to add in with the other cool part is then I work with others. And then when I'm working with one client, I might say, you know what, this is awfully familiar to what this other person was managing. And this is how we dealt with it there. And sometimes there's almost like a little bit more buy-in. It's almost like a social proof type of thing. Well, oh, that worked for them. So yeah, they have more confidence in order to try it rather than just some guy who walked in and said, here's an idea, right? Sorry, I didn't mean to interrupt.
No, it's good. I think it's a good add-on because I think that's one of the awesome things about you is you know this space, you understand the dynamics of humans in a workspace, you have focused in to the medical clinics, you know them, you speak about their problems in great detail and specificity, and not just because you read some books, because this is what you've been doing and this is who you've been helping. I'd love to hear, so you painted a bit of a picture of what happens when you work with someone long-term and there's this first workshop and then it gets into the leadership stuff. What are some of the outcomes? Like someone who's worked with you, what are some of the outcomes that you've been able to help people get?
You know, on a very, I don't want to say surface level, but a level that you could see tangible is less turnover, less people leaving because of conflict, inner conflict within the team. And I know it's a bad thing to say in healthcare. People don't want to equate money with healthcare, but billing. If people can communicate better their intention with one another to better serve their patients, they can do more in less time. And I did, at one point I said to someone in a conversation that it ended up becoming a client, and they said, you know, the one thing that worried me about what you said when we first started working together is that you were going to help me see more patients. And they're like, I don't want to see more patients. I want to see the same amount of patients in less time. I'm like, gotcha. And that was a very good lesson for me, right? Because I thought, in healthcare today, we're not looking for more work. If you can, in the same, maybe let me just make a quick correction on that too, to make sure I'm clear. If you have an 8-hour day, they want to see as many people in the 8-hour day. They don't want to see more people in a 10-hour day, right? So, the final thing, and this is the part where I find that most clients are a little bit hesitant, is like, it increases the morale. And how do you put a dollar sign, a tangible, like, how do you put anything that you can quantify? It's very difficult. So, but I would say that's probably the most important one. It's great. Of course, you want to make more money. You want to, like, if you have cash flow problems and you're having trouble meeting, paying your team because you have a bunch of no-shows, or some follow-ups didn't show up, or you went too long with a patient and someone said, I have to leave, and they walk out the door. When someone walks out the door, you don't get paid. It's not salary. This is fee for service, right? So, those are all really important. But to me, the morale and the happiness, and when people work together and they get together and they want to be in the lunchroom and they want to talk together, that adds a whole other area. And I take probably the most pride in that when I come in with a group and I see that it wasn't really happening as much. And then when I leave or continue to work with them and I see it evolve, that's the one that I think really is the most underrated.
Underrated. And it's interesting because you started with the more measurable things at first, because more tangible, more measurable, like I can see it, I can believe it. Turnover, billing, absenteeism, all these things, they're all connected, but morale. And yeah, how can you put a price tag on it? Like, even if we could quantify it, but it made me feel weird to try and put a price tag on it. So,
and maybe how they interplay is what I said before, when someone stops showing up to work or they're having trouble, they don't want to be confronted on a certain day. It puts more pressure on the other people, and that brings the morale down. So there's maybe a tangible path to it, but you can't just like take a scanner like you do at, I was going to say Zeller's. Help me out. Walmart, I guess. You can't just put a scanner on someone and says, your morale is currently at 78%. We have, 22% that we could really make an improvement on. How do you measure that? Right.
It sounds very dystopian. Yeah. There's surely an episode of Black Mirror that's working on something like that. You answered the question, and you did give some tangible, like, these are the outcomes. And I feel like you downplayed a little bit, because you have one of the craziest client case studies that I think I've ever heard, as far as a client and where they were before and where they were after. And I want to put you on the spot and ask you to share this particular story, because it's mind-blowing to me. And I've been around a lot of people and heard a lot of stories and seen a lot of things happen. So tell us about this one particular client and what was happening with their clinic before and what's happening now.
So I reached out to this, I did a workshop with someone, and they said, you need to talk to this person. I think they would really like with what you're doing. So I got his number, and I was familiar with this person from before, from my previous career. And we were back and forth on the phone for a year and a half, 2 years. Finally, he calls me and he says, listen, I want to start. Let's go. Right? When can you start? How about next week? Perfect. And we started, and we got things rolling. I met his team and went through, and we were off to the races. Still work with this person today. About 6 months in, I said to him, why did it take 2 years to hire, like bring me aboard? What led to that moment when you said, let's do it, right? And he says, Mike, my dad used to tell me, when it's raining, you can't fix the roof, and when it's sunny, you don't have to. So during that period of time, those 2 years, he had 22 people leave. And that has an impact on your billing, has an impact on the morale of other people, and the what that's doing to those that stay. It's almost like they feel like there's a punishment for staying, because then you're having to pick up the pieces, right? And manage and train new people and do whatever. So, to then turn around and have, since we've been working together, have no turnover, and then have a significant improvement in billing is certainly a success story, right? To stop the bleeding. And then at the end of the year, we did, with a little leadership team, I did an exercise at the end of December, and I said, tell me what's good, right? What have we done that's really good? And the routine, detail-oriented people also have a trait that most people look at as a negative, and that's pessimism. They'll look at a situation and say, I see all the things that could go wrong here. And that's what makes them effective, because they will always prepare to not do those things. So when I asked them that question, it was, well, we had this problem. Remember back in February, this happened. Remember this happened. I'm like, don't talk about that. Just tell me about the good things. So in my book, I don't have my book. I could have brought it. 5 pages of all good things, but I had to keep coming back to it. No, I don't want to talk about that. Let's talk about what was good. Oh, actually, we did this, and we implemented that, and we changed this. And, once you go back and you look at it, it's amazing. But we never would have had that conversation if someone like me weren't there as a facilitator to be able to go back and look at those things. So to go back to your question, it's an amazing example. And part of me doesn't want to take any credit, because they did all the work. But my role in it was as a catalyst, as maybe not holding people accountable and saying, well, you said you're going to do this and you never did, but reminders. How, let's revisit what you were planning on doing last time we spoke. How do you ask these questions so that they can come to their own realization that, oh yeah, I did say I was going to do that, or this was really good, or I could be better at that, right? And so for a clinic owner, they don't have time to do that. They want to do that. They don't have time to train. They don't have time to have half-hour conversations.
And what I'm hearing there is, so earlier it was very clear you're explaining that you've got workshops and you've got frameworks and you've got these different tools that you use with people at different points in time. But also what I'm hearing now is that, but also you play this additional role with people that work with you in a more partnership approach where you are holding them accountable and reminding them of the things they said they want to do and allowing things to actually happen, because it's nice to say you want to do things. It's a whole other thing to actually do them. And you have this quote that you say all the time, don't do nothing. And it sounds like when you were telling that story that essentially this clinic owner, he did nothing for an extended period of time. During this extended period of time, 22 people left, which left him in a real lurch. So tell us about the don't do nothing, the human scaffold don't do nothing. Tell us about that.
It stemmed from that story. What I realized when they shared that with me was they accepted that having people leave and struggling through that time, maybe that's just the way it is, and you can accept that. But the don't do nothing came from, well, don't do nothing, do something. That's not normal, and you shouldn't accept that, and find a way to make it not happen. And if it's to call someone like myself, great. If it's to figure out, if it's to read a book or to have your own meeting and you run it and you do the whole thing, whatever. But don't think that inaction is the right approach.
Yeah, inaction just means that more bad things are going to change. It's the famous quote,
if you choose not to decide, you still have made a
choice. It's still a choice made. Exactly. If you chose not to make a decision, you still made a choice. So why should someone choose to work with you then? There's obviously tons of people out there that do some kind of communication training, leadership stuff, but you talk about it in a different way, and I don't want to answer it for you. But so, yeah, why should someone choose to work with you versus the other options that are out there?
One of the biggest challenges that I've had is when I meet with someone, we pull together the agenda, I'll present it to them, and then I'll say, here's what I'm thinking. Here are some of the scenarios that I'm considering based on what you told me. And most times, 80, 90% of the time, the scenario that I've created, we have to pull back on because it's too real. And I think I've hit on something where I'm able to imagine what they're saying and then create a scenario that is so real that it actually is too close to the bone, too close to the nerve. So the feedback that I receive is that, Mike, we really like working with you because it's almost like you're here. One guy was like, it's almost like the room was bugged before you got on the phone. Is literally we were just dealing with this issue. So I think a real advantage is that from that niching that I at first resisted against going that route, but now that I have, just by doing it over and over, you have a great understanding of what people are up against, and it's a really cool thing to not be in the environment, to not be with them, or else what I'm presenting wouldn't be as effective. It's nice to have that person that is joining in, parachutes in, and gets carried out. I guess you don't parachute out.
But you get to walk out. You parachute in and you get to leave. And what I'm hearing you say is just how well you understand these people from the fact that you've niched down and that you've worked with clinics before, you know this space, you've worked with so many now, that when you work with them and you present stuff to them, they're saying things like, it feels like you've bugged our clinic. It feels like you're reading our minds, which obviously then allows you to work with them in a way more intimate way versus, I don't know, and maybe not everyone's been to these kinds of things, but I have been to trainings, to leadership trainings, to communication trainings where the examples were just terrible. They were just very unrelatable. It felt very forced. I was like, this doesn't apply to me and the roles I'm in. Or it was trying to bring together people from 7 different industries who worked in different size companies, because it's not just industry, it's also size of organization. Because if you've got a medical clinic, there's a certain amount of people. It's more than one, but it's probably like there's probably some upper number. You could probably answer this better, and that's much different than when I've worked in organizations with hundreds and thousands of people. Maybe it's actually an interesting question. I don't know that I've ever asked you about this before. Talk to us about the unique challenges that occur in these clinics due to the size. Because earlier you were giving examples based on the reality of the medical world and the way the billing works and one problem per visit. But what are some of the unique challenges based on the size of these teams?
I was at a conference with 120 medical clinic managers from family health teams in Ontario. I had a workshop with all 120 of them. And as I was going around, we, sent all the information ahead of time, did the pre-read, created the scenario, and everyone's sitting at tables of 8. And so then I'll give you 15 minutes to talk about it. As I went around to each table, as I got to hear what was happening as I was questioning them, every single family health team in the province of Ontario here in Canada is completely different. There's no one size fits all model. There is Oshawa that has 250 people in their family health team, and Red Lake where there's 3. So to be able to go and then say, here's the solution, it doesn't work because it's so different with everyone. So the approach has to be meeting people where they are. And again, when I was a teacher, that was instilled in me, drilled into me for a year in teachers college, the student-centered classroom. How do you meet people where you are? How do you help them to create their own learning? And that's the approach that I take because I believe it's not out of the box. I can't be, to your point earlier about what if it's from another industry. If I'm a tech person, I'm coming and working in healthcare, absolutely, everyone has something to share and something to learn. But when you're so focused and invested in learning more about what each team is like and how they're unique, that's where the magic happens. And the more I do it, the better I get at it, the more value I bring, especially in an evolving health system. Now with AI scribes, press play, your doctor's sitting in the room with you, and then you have the discussion, and then at the end, they're like, okay, print, boom, there's your notes, here's all the things we talked about, here's your medication. It's pretty cool, right? So as you're evolving, people's roles and job descriptions are evolving, so what does that mean? People walk away sometimes thinking, well, I used to like being the person in the room or on the call, on the virtual call, being the scribe. Well, we're not doing that anymore. So what does that mean? We have to have the discussion about what it means for you now. And that's the problem with no one has time. When's the last time you walked in and, it's like going to a barber shop or the barber's sitting on the chair reading the newspaper waiting for someone to come in. That doesn't happen in a doctor's office.
It doesn't happen. No, there's a lineup, there's a waiting period, there's even the best run places. There's an edge of like busyness or stress. Like it's just like there's lots going on. We got to move, and I'm grateful when I'm in those situations and the person is treating me like an individual. As like I can tell you're stressed, and you're able to for a moment make me feel like you care a little bit more. But the default in a lot of places is it's stressful, it's busy, we got to go, we're short staffed, everything's changing.
Yes. Yeah.
Is there anything I didn't ask you that you wished I would ask you? Is there anything we didn't cover that you wished we would have covered?
No, I don't think so. I think we covered quite a bit of ground. At the end of the day, it's a challenge, and I'm sure that you would recognize that you want to be able to. I want people to know that this exists. So many times I have conversations with people, or I have a booth at a conference, and they're just like, I never knew anyone like you was around. Like that now we're at that level of awareness where people are just, they need to let this ferment in their brain. I can't even wrap my head around this. I didn't think that was a thing. right? Or someone could come in and do a workshop with my team that just works with medical teams or does leadership stuff, or I could hire them and have them come in as almost like a fractional support of operations or whatever that looks like. And then there's others that are aware, right? But still choose to do nothing. And that's fine, right? But really, I guess the challenge is, and you asked, is there something that we didn't discuss? And I guess that's a big part of it is, if you think that things could be better, then act on it. If you're not aware of how things are better, then research it. And if you see that it could be better, then what are you going to do about it? And if it's me, great. And if it's someone else, that's fine. And if it's you figure out yourself and you bootstrap it, great. But there's so many patients walking around. I watched the debate the other day for the upcoming election, and healthcare. And they're going to put more money and they're going to do all these different things. I agree, more money, especially for structural things, more hospital beds and type of things. But I think we could get a lot more out for the money that we're already investing, because it's a lot of operational expenses for our province right now. How can we be better and do more with the same amount?
Ooh, I love this, because this ties back, obviously, a clinic that is running better, has better morale, people understand each other. It inevitably leads to efficiency. And then you're talking also like on a system basis, it exists as well. So for someone who's listening to this, who recognizes they have a challenge, is willing to get out of the doing nothing, wants to take a first step, what does that look like? What's the first step if they're considering working with you? What is the first step? What's the first conversation like? Like, what can they expect?
I want to understand what they're up against. And I want to ask them questions to better understand if what they think the problem is versus what the problem could be that they haven't considered. And then from there, the conversation can look at many different solutions, which may include me, may not include me, or it could be whatever, right? But I think having that conversation, especially with someone who has done it with others and has worked in other areas of healthcare, not just in medical clinics as well, but with patient support programs or whatever else that looks like. There's a lot of solutions out there, and I guess in some ways it's just you don't know what you don't know. So if after a half an hour conversation, if you pick up some things and you're better off for it, then why wouldn't you?
I love that. So it's like minimum, no matter what, worst case scenario is they have a 30-minute conversation and they learn some things that maybe they can apply on their own.
Yes.
But yeah, it's very clear that between this and what you're saying earlier, that you don't have some kind of forced cookie cutter approach. It really is just a conversation, where you're at, what you think the problem is, and understanding that. And then do you think you can help them? And then it's like, does it make sense or not? Versus it doesn't sound pushy and it's not cookie cutter by any stretch.
Rob, it's about an average of a year and a half from the first time I talk with someone where for the time that they actually, if we do work together, something happens. So it's generally not something people act on very quickly. Sometimes they do, sometimes they don't. But where do you start that conversation, and how do you get better? And we can all think about different things that we've happened in our life that all started with a conversation. You look back in 3 years and say, wow, I ended up going there just all because that person put that idea in my mind, and then it germinated.
So powerful. I'm excited. It's fun because I feel like I know you and I know your business so well, but I've learned a bunch more through this conversation than some things that I didn't know yet, which is
the best part. It's all on tape.
It's there to be.
Thanks
really
to Frank.
Awesome.
Shout out to Frank Russo.
Awesome. All right. I feel as far as this part of like asking you questions, like I feel like we've run through stuff, unless there's anything you want to add, but I feel like
nothing else to add. We really appreciate it, Rob. It's really cool that you took the time to.
Okay, cool. Well, then in which case I would love to switch it up a little bit and ask you a couple different kind of questions. So
sure.
You mentioned earlier we've been working together for 2 years, and hesitant to niche at first. Maybe when we first started speaking, when we first started working together, where were you? What was going on with you and with Human Scaffolding? You paint a picture of where you're at back then.
So I'll put the shoe on the other foot, and I've been talking about people not doing nothing. I did nothing for a year, we chatted and we had a half-hour call, and it sat and it germinated for a year. And then I called you back out of the blue, if you remember.
I do remember.
And then at that point, I had tried a number of different things on my own, and I just wasn't getting the uptake that I wanted. So the first conversation you had is, have you ever considered, niching down and not being so wide or general? And I said, I have, but I don't think I want to. And I think I said something like, I think I'm going to push you back on this, right? And so I pushed back for about 15 minutes. And then I realized that there's something to that. And it's not like I said, oh, okay, hey, I'll just do this. Like, it took time. And the other thing that I really learned from you have, for anyone, Rob's company is called Growth Habit. And he has a group or a program called an Impact Accelerator. And you can go onto log into Rob's client portal, and there are like a ton of, courses, I guess what you call, is that what you would call them?
Or lessons. There's a bunch of different lessons. Yeah.
Each one's like 10 minutes long, has a video of Rob presenting an idea, a concept. And then there's something you download that you can work through, right? So the first time I kind of went through it, half-assed, download, filled it in and everything. And then it wasn't until a year later when I was painting my kid's bedroom that I went back and listened to the videos as I was painting. And I thought, why am I not doing this more often? Why am I not doing the very thing that I'm telling my people to do, that I did it, but I didn't do it with enough intention and purpose? And then it was after that year that things really turned. That's where I really niched down, and I really started to get more I don't want to say critical because it has a negative connotation, but purposeful about where I wanted to go. And that had a huge impact. And I probably mentioned it to you, and it probably ended up as a social media post by you. Because, of course, that's a huge breakthrough for me, just like it is for my own clients when they say that. But if you're going to be, I don't want to, I got to give myself credit. It wasn't lip service, but I had to maybe just take it to another level where I could really take what's there, that's gold, and I have to do the work. It can't be fed to you. It's very nicely presented and it's easy and it's amazing, but I have to roll up my sleeves and do that work. And when I did that, that's where I really started to see a big difference. And when I think back, last year I doubled my revenue, and then I doubled it before that. Now, if I start doubling it, now we're really talking. It's not quite that exponential, but wouldn't it be great if it is?
I love it. So there's this part, like putting the shoe on the other foot, as far as did nothing for a while. I remember that conversation where I asked you what it would be like to niche, and you pushed back, and it was an interesting thing. It was a really engaging conversation for me to have. But you've embraced it, and you talk about the Impact Accelerator and the fact that you doubled your revenue one year and then you doubled it again. You mentioned the Impact Accelerator. There's all the lessons in the portal. What are the other parts of the program that you enjoy for people that have no idea? Because you mentioned the name, and so we know there's lessons and people know the name, but what else is in the program? What else are you enjoying about it?
It's interesting we're having this because we never ever talk like this, right? So when I first started working with you, you were more of like a one-on-one coach. And then after a year, just by chance, you switched to more of a team coaching mode. And it's interesting that now you start getting into moving away from a one-on-one. Okay, Mike, we had a conversation this month. Let's, here's some things you can work on, you commit to, and then we'll talk about it next month. Now you have 3 or 4 different opportunities during every week to join a team call where there's other people that are just like me in a way, but don't do exactly what I do. And you can learn so much from it because for a number of reasons. Number one, you come with a problem and the group discusses it. And then you come back with some solutions. And then people get to know you after a while, and then they come up with, really good solutions rather than just general solutions because they know what you do. Number two, you get to see what other people are doing and what their problems are. And then that's tying into the, you don't know what you don't know. I'm like, man, I never even considered that. And then you get to see, number 3, I'm just coming up with these numbers as we're going in the fly, but it sounds really good, doesn't it? Number 3, then you get to see it actually play out from one week to the next, because then the person leaves, you leave the call, then the next week you come on, and then sometimes you're not on the same call with the person, then I'll text them, I'll say, how did it turn out? It's almost like an episode of Batman. I missed the follow-up, next time on, Batman and Robin. And probably the most important one is the modeling that you present and that you do in your own business and that you present and you're suggesting and the experience that you've had. So when you tie all that together, it's super cool. And you become friends with people that you haven't met that sometimes are on the other side of the world. And that's pretty cool. And kudos to you for creating that.
Thank you. It's really fun to hear you reflect it back, because there's the parts that I was aware of as far as the benefits of being in a highly selective, like I curate who's in there. It's very much highly curated. So I know that there would be some learning from each other. I know there would be this, like, as people get to know you and your business, and that kind of amplifies it. But the friendship piece, I don't think I had fully understood how deep it would run. And people, like, they care. And this, like, checking in with you, how did it go? It's not just because I'm curious about missing the episode, but it's also because I care. Mm-hmm. And I think that part's been really rewarding to see the evolution of it. So yeah, it's great to hear you explain it. Thank you.
And then you did that event in October where you bring a whole bunch of people in, and there's people that came. I think there was one guy came from Europe, and some other people came from the U.S. way down south. Someone came from Florida, or I think it was Florida, Texas. It's super cool, and to really meet those people in person and be able to go through that is really another unique part of the experience. Didn't have to happen, but once you get in, and the other thing, and I've been using this with clients ever since, is making a bold statement in front of a group of people. You're more likely to commit to following through rather than writing it down your notepad and saying, that's what I'm going to do in 2025. So
that's cool. That event. Yeah. Someone flew in from Germany, Sebastian, someone flew in from LA, someone came in from Texas, Vancouver, Florida, New York City, Calgary, like all over. So it was really great. But there's this other aspect of what that happens too, is it's lonely to run your own business.
Yes.
Like this friendship thing you were talking about earlier, and then people coming in person, it can feel really lonely and isolating. So this community piece and the big world event that kind of stopped things for everyone, that started half a decade ago, if you're willing to believe it's that long ago, I think that reinforced how important the community piece is. And thank you for mentioning the bold declaration thing, because the event is all about doing bold things. I already swore once on this. I'm going to try not to swear again, but the event is called...
Yeah, do bold shit.
There you go. So you've said it once.
You didn't have to swear. I did.
Because I have a potty mouth, and whenever I'm presenting anywhere, I always start with this kind of caveat, like, I'm passionate about what I do. I care a lot about this work. Sometimes this passion comes out with colorful language, including swearing, and it's hard. So this whole hour with you, I'm like, don't swear. Okay, you said shit once. Definitely don't say the F-bomb. Like, we can tame it in. Yeah, but yeah, the event's called Do Bold Shit, and it is about declaring, doing bold things. And it's incredible to see the bold things that people are doing now. We're only a few months after so we're 4 months since the event, and seeing some of the bold things that people are creating. Awesome, Mike. Well, look, thank you for sharing all this. Thank you for having me here.
Thank you for coming out. It's great. I can't wait to see the result.
Fantastic.